by co-sponsored by the Medical Students and Residents Committee. Before we get started, I kind of wanted to do just a brief little love letter. Alyssa, keep me accountable for 1 minute and 30 seconds to AACAP, and express my appreciation and gratitude for this organization. So after my first year in medical school, I got the Gene Spurlock Research Fellowship, and I attended my first conference, and I was blown away by the Meet the Life Members session. It was just very inspiring to see all the life members share their words of wisdom. And then I also attended an advocacy boot camp. And at every single level, from the fellows to the life members to the child adolescent psychiatrists, they were advocating for our patients. And I was very, very inspired by that. And Alyssa can attest to this, that my whole med school career and all the work I do in the community here in Galveston has been around advocacy for students and advocacy for kids and just promoting child and adolescent psychiatry. So all that to say that for the students here, feel free to ask your questions in this breakout session. We may not get to everything in the Q&A, but truly and honestly, AACAP has been a big family outside of my institutional family. And there are a lot of my mentors here. I know Dr. Shifu, I will text her random pipeline ideas that I have, and she's more than happy to support my dreams. And so just feel free to be open and ask as many questions. We have people in the chat. We do ask that muted as well. And we also ask that everybody reconvenes at the end of the breakout session room too. So without further ado, I'm going to have the panelists introduce themselves and we can get started.
Dr. Stubbe, would you like to introduce yourself first?
Would love to introduce myself. Hi, my name is Dorothy Stubbe. I am the program director at the Yale Child Studies Center. We have both a fellowship program and we have an integrated 6-year program that does adult psychiatry, child psychiatry, and research. I have been a training director now for 26 years and I still absolutely love it. And I still love the kids that we treat every single day. And I really loved what you had to say about advocacy. Child psychiatry is a wonderful profession and kids really need us. So it's been an honor.
Hi, this is Brigitte Bailey. I'm here at University of Texas Health Science Center in San Antonio, Texas, and I'm the CAP program director. And I think, you know, I'm just honored to be here on this panel to help answer questions due to anyone to child psychiatry, because I think that's the best discipline of medicine. So I'm a little jaded. But I'm here to answer questions to help you out to get into psychiatry and on your path to child, if that is one of the options you're interested in doing.
Hi, everyone. My name is Daniel G. I am the program director at the University of Nebraska Medical Center here in Omaha, Nebraska. I am a child psychiatrist and also the founding program director of our relatively new program. We're in our 3rd year of operation and looking hopefully to see some of you on the interview trail here in the next few months.
Dr. Williamson?
Hi, I'm Edwin Williamson. I'm the child program director at Vanderbilt in Nashville for child. And I really like what you all said about AACAP. It is a wonderful family, and I love seeing all my wonderful siblings and family members out there.
Dr. Hunt?
Yeah, I'm Jeff Hunt, the program director for Triple Board and the Child Psychiatry Fellowship at Brown, and would echo my colleagues. It's an honor to be here with so many people interested in child, and look forward to seeing many of you on the interview trail.
And Dr. Jacobson?
Hi guys, I might be changing technology in a few moments. I'm currently on my phone and trying to get my Wi-Fi rebooted. But anyway, I'm calling from Pittsburgh. I'm the program director for Child and Triple Board here. I'm also the co-chair of the Training Education Committee at AACAP, and it's just such a delight to share this room with all these amazing people. So happy to talk to you guys about recruitment, both from medical school into integrated programs like Triple Board or a 5-year track, as well as fellowship recruitment. Nice to see you all.
And those are all of our wonderful panelists, and we look forward to the Q&A portion coming up here shortly. So some of you might be kind of wondering like what some of the words are that they threw out, the triple board and the combined track and research and everything. I'm going to share a link in the chat here shortly, but I'm also going to share my screen. Our AACAP website has, well, maybe I'll share my screen, a fantastic breakdown of all of the ways that you can get into child and adolescent psychiatry. So it is through our website. Let me see if my share screen is going to work now. Annika, I might have to have you do it and I'll just talk over because it's being interesting on my end. Okay, one moment. While she's pulling that up, I can go ahead and talk a little bit. So this is just a brief overview to give you some information. So everyone knows that, you know, or most people know that there are multiple pathways to get there. You can go the traditional pathway. So you apply to a general psychiatry program, you do all 4 years, and then you go to child fellowship, which is an additional 2 years. There are a lot of programs that allow for you to go straight into fellowship. So those are our integrated tracks. So where you do 3 years of general and then 2 years of child. Different programs have various requirements of, you know, the pediatric experience that you have before then, and if you have child clinic and whatnot there. And then there are the fast tracks. So you don't have to be in one of those combined programs to do that. Then there is our fantastic triple board colleagues. So we have a couple of our program directors, as they said here, that do that. So those pathways allow you to be exposed and boarded in adult and child psychiatry, as well as pediatrics. And then for those who do go into pediatrics first and then decide they want to become child psychiatrists, there is the post-peds portal as well. And then there's research. There are so many ways. One of the wonderful, beautiful things about child psychiatry is that you can get there if that's where your heart desires in pretty much every facet of the way. And there are a lot of opportunities to explore what you're interested in, whether that's research or consults or forensics. There are still a lot of subspecialties within child. So again, that link that I shared will provide more information, more specific lists about which programs have those different opportunities and different pathways. For instance, I'm in one of those integrated tracks at UTMB, so I don't have to apply for fellowship right now, which is a very nice feeling to not have to do that. So I'll go straight into it next year. So those are just kind of those few things to kind of orient everyone to the terminology that will be used tonight. And we're actually running a little ahead of schedule, so maybe we can get to more questions. And I'm going to turn it back over to Bianca.
Thank you so much for answering all that and clarifying the different pathways. I'm still waiting on a child psych residency, wink, wink, ACAP, but we can go ahead and get into these questions. So I would like that one or two panelists to answer the question, just so we can get to as many as we can. Question on everybody's mind this year is that psychiatry has added supplemental applications to signal to 5 programs. Do you have any tips regarding the supplemental application? And what is the supplemental application for some of us who may have not kept up? Anyone can answer.
I'll take a crack at it. So I'm again, I'm a general program director for our residency training program here in Omaha. So the Supplemental app is a new tool by ARIS this year. So ARIS kind of runs, it's one of many 4-letter acronyms you will quickly be fond of or hate. but it was piloted last year by a couple of residency, couple of specialties. And this year it's been widely adapted and adopted by many, if not all, specialties. So there are a couple parts of the supplemental application this year that is separate from the main ARIS application. One of the key things to think through is that the supplemental app actually opens on August 1st, so a few days from now, and you have a couple of components to fill out. So the three main components are the additional experiences that you can highlight from your CV, and it's an opportunity to kind of really put why these experiences are meaningful to you. You can tag them so they're easier to find. But it's an opportunity to spend some time outside your application to say why these things are so meaningful. There's also a geographic preference. So you can tell programs up front that you have no preference, you'd be willing to go anywhere, or up to, I believe, 3 out of the 9 census regions of the country. So you can pick Pacific, you can pick South, you can pick Northern, Central, Midwest, and there is such a thing. And you can do up to 3. And for each of these preferences, you can actually put in up to about 300 characters why this is so important to you. So you might say, as an example, I have a significant other, I have a lot of family or support, or I've always wanted to move there, or my family just relocated to a different part of the country, and this is really meaningful. The third piece is the signals or preference signals, which are probably more commonly mentioned as. And so psychiatry this year will have 5 signals. It is free to all applicants who participate, as it is to the program. So this is not an additional cost, but it's a way to signal to a program that this is probably one of your top 5 choices that you would like to receive an interview from. So programs will see applicants and their applications with a signal. If you don't get if the program doesn't get a signal, there's no indication by the program to us as whether or not we got one, or you didn't participate, or you didn't use all your signals. It'll just simply say that this person applied to our program. And the signals are really meant to draw additional attention to your application in a way that in years past, sometimes doing an audition rotation or sending a cold email to the program director to say, you know, even though I'm not from this area, I really like your program because it's been my dream program, et cetera. And roughly speaking, just at least based on the data from dermatology, internal medicine, and general surgery last year, the use of a signal will probably increase the likelihood of an interview offer by about 2-fold. So the most important thing is that about 93% of students last year who were in those 3 specialties participated in the signaling program. And virtually all programs, and I believe it's somewhere between 88 to 92% for psychiatry this year, because programs actually had to register for the supplemental app. But my main thing for students is twofold. One, you're going to have to research your programs a little better. So you're going to have to know up front what really kind of clicks and fits for you, whether it's geography, you're really interested in psychotherapy, you have the opportunity to enter any fellowship potentially from that same program, et cetera. And my second tip is use all the signals. You can't put more than 1 signal on a program. So this is not roulette where you can put all the chips on one spot. Use all the signals. There's no advantage to keeping tokens to yourself. So it's important that you do send all the signals out. And related to point number 1 about researching your programs, well, this is the opportunity for you all to check in with your medical school advisors. If you're partnered, probably checking in with your significant other might be really important as you're thinking about this process. And my last piece of advice about the supplemental app, just like the ARIS application, you got to do things on time, because for most programs, it's a rolling interview process. So when they see your application, of which usually 98% of our applications come within the first 48 hours of ARIS opening to programs, if you're late, it's really actually going to significantly hurt you. So do and follow all the information from ARIS. There's actually a really helpful PDF worksheet that you can walk yourself through and practice almost writing tweets like why this is so important to you or why this preference is really important to you. But that's a short summary, and I'm happy to answer any questions, or people can send me some messages through the chat. But that's supplemental applications for this Match 2023 cycle this year.
Thank you so much for the very thorough response. one just quick follow-up question is, you kind of hinted on geographic bias, that a lot of people submitted and asked questions about, is there geographic bias? Is there DO bias? Is there IMG bias and the type of applicants applying? So essentially, do you think these signals will be beneficial in terms of advocating, like your program accepted 2 IMGs in the past few years? Is that a valid thing to put on there for geographic? Maybe I may not be from this area. I have a couple family here, but the research specifically in this area can progress my ideas forward. Are those appropriate things, or same thing with the DOs? I just want to address bias because that's a lot.
Yeah, that is an awesome question. I wish I could point to data on how this is all going to play out for psychiatry. It may be slightly different between specialties. But again, going back, and actually the AAMC, for anyone that is interested, they actually published or put out some white papers about how programs last year used the supplemental application. But it does appear that minority students, including those underrepresented in medicine, actually utilize the supplemental application more than white students, which we thought was an interesting finding. Asian students actually more co-located with underrepresented minorities than Caucasian students or applicants. And then I guess to answer your other parts of your question, Bianca, it appeared that IMGs and DO students actually use the supplemental application more than MD senior students. So I think for all those things that you mentioned, I think it's a disadvantage to the student not to participate in it. There's a lot of, I guess, chatter among our training organization, whether or not this is just more data for us to ignore, or if it's more data for us to make some wiser selections. I do think that if you are genuine in your interest and it's conveyed through the supplemental application, it's less likely to be ignored, because some programs, and this is not a promise, some programs have said, we will review by hand every applicant who gives us a preference signal. So in years before, it's kind of like who you know. Some programs might be biased, as you said, against IMGs or DO students or people in couples matches, et cetera. So I do think that this is ultimately going to be helpful for students. It's not clear how programs are going to respond to this. I should say too, that I'm also on the recruitment committee for AdPERT. So we literally discuss this topic every few weeks. And I believe what I've said is a fair consensus of what's been happening.
All right, thank you so much. So we're going to go on to the next general question and common theme that came up regarding STEP. So the first step is now pass-fail. How are program directors looking at this, reviewing applications? Are we putting more weight on step 2? In general, how are programs viewing the first step being pass-fail?
I mean, I think that all of these efforts are really trying to level the playing field for underrepresented in medicine individuals. That was the idea, that some people had, because of their background, have had the opportunity to get a lot of tutoring, et cetera, they may do better on tests. But what we really want as a physician is someone who has empathy, someone who's competent, someone who listens well, many things that really are not demonstrated through just, the steps. So I personally am rather glad that they got rid of the numbers, because some specialties, if you're one number different, then, they put you higher on who's going to be invited. And that just makes no sense. I think passing is important, but I think just differentiating between the numbers probably is not as important, and it probably does or has, and may continue to, for those programs, disadvantage individuals who are underrepresented in medicine. I don't know how others feel. I know the surgical specialties and some of the really, dermatology, some of those that are really, really competitive, they use that as sort of their first pass. It's too bad, but I know some programs have done that.
Any other comments regarding
I'll
STEP?
just say it really varies program to program, and this is a thing that programs they're not transparent about. They don't say, oh, how much we weight USMLE versus this and that. And, for now, if one is pass fail and the other, and step 2 is scored, I think those programs that use that, will use step 2 more. Which is too bad. I think all of us here are have seen a lot of, years over the time that there's no correlation between step score and quality of resident, however you define it. If you were to rank all of your, senior residents, which would be very hard, every faculty member would have a different opinion, but even if you could have a general consensus, there's no correlation with the step score. So I hope this will be a long trend towards diminishing the value of the steps in general. But for now, I think a lot of programs still do use it because it's an easy click, unfortunately.
Yeah, at Brown, we have over the last 2 years have eliminated the boards other than pass fail. That's all we put in the package that we give to our interviewers. And I mean, I'll see it because it's going to be in EROS, but other than that, it's been taken out of the process.
Here's a follow-up question to regarding STEP. For students who may be taking their steps a little later in the cycle, how do programs view that? We got questions regarding that as well.
I'll take this one on. So I think, so it's changed in the last 10 years. A lot of programs used to never require step 2 as a condition to be interviewed or be offered one. Unfortunately, I think as psychiatrists becoming more competitive, and arguably we're as competitive as dermatology, which I think none of us would ever have predicted. I think step 2 is more of a gateway. I think the score doesn't matter, but I can almost promise you every program director just before the rank list goes in for the general match is probably not going to rank students who do not have a passing score either on step 2 or the COMLEX level 2 exam. So even for students who are a little bit late to the game, maybe they didn't get set up with their testing site or date, I would still strongly advise you all to basically take level 2 or step 2 well before March, if at all possible. I know in the last couple of years with COVID and test sites like literally being canceled the day of or the morning of that you show up to step 2, this has been an incredible impediment. But I have seen even in pre-COVID years that step 2 and level 2 have been kind of a rough requirement. Again, the score I think is not as important. To go back to the question was asked earlier, psychiatry historically has never used step 1 or level 1 as the main gateway. The main decision factor for interview has actually been the personal statement, which is, by the way, the one area where students and applicants have full control, right? And you can do your personal statement weeks or months beforehand, which I would strongly encourage you to do. Now you don't have as many months now, but it's the one area that I think that psychiatrists, because we all generally love stories, want to use as one of your main determinants for interviewing. So.
Thank you. So moving on from that question, we always talk about a strong application. So what do you all define as a strong application? What's one thing that you're looking for in an applicant? What's one applicant that probably who's successful in your program that you're like, okay, from their application, we could tell that this is their trajectory and this is why they're successful?
I would say, oh, go ahead. Go ahead, Sansea.
I'm going to try and interrupt me if my technology is too terrible. But I would say, and I think a lot of us agree here, that there isn't a perfect algorithm for a strong application. In psychiatry, we are really looking for candidates who are passionate about what they're passionate about, who have a narrative that they want to tell us about. And, I think, one of the things that has already been sort of raised is the importance of the personal statement. And I strongly recommend that your personal statement is a little bit personal. It's like about you, not just clinical vignettes, but what excites you about the field? What do you imagine yourself doing in the field? And maybe even something personal about what got you to the field, if you feel comfortable. And that's really where mentorship can help you, so that we can look at your CVs, we can look at your ARIS applications, we can look at the letters of recommendation. But at the end of the day, what you put forward in terms of what you want us to know about you in that one-page personal statement really is helpful when we're doing that global review.
I would also say that the rest of your application should have some connection to your personal statement. A lot of the volunteer activities that you might have done even earlier in college, even, if they relate to child psychiatry or psychiatry, you can see my child psychiatry bent, that those would be good to put in there. And, I think also research, even if it was in another field, it's good to acknowledge that you were involved in some scholarship and trying to show that the passion also translated to some activity would be good.
And I would add that, that like the personal statement you're in total control of. And I like what Dr. G said, is you are in control of that. It is important, and have someone else read it besides you, even if you're a great writer. Have someone who's seen a bunch of personal statements. That could be, clerkship director, a program director, a fellowship program director, someone who's seen a lot of personal statements to see how does it flow, how does it go. The other area where you can influence is your letters. And so, you obviously probably thought a lot about who is going to write your letters, but write them a letter to kind of let them know what you would like, why you're choosing them, why you're asking them to write you a letter, what experiences did you have with them that you thought would really highlight your strengths in your application. And that should be different for each letter writer. They'll have some commonalities about how great you are as a future psychiatrist. But it is nice when I read an application and there are 3 different letters that say something different about the person that highlights something good. I say, wow, they've really impressed more than one person in more than one different way.
I also think that if you have had adversity in your life that you've needed to overcome, I guess we're talking about personal statement, but I think the idea that there's been a passion that you really want to make the world a better place, and how have you, sort of your journey on how you've expressed that in the different things that you do, can be, I find those very compelling. And, being as personal as you feel comfortable with, you don't have to, completely tell everything about yourself. But I do think the idea that you've had a passion, that, what you want to do will make the world better, and how have you managed the obstacles that have been in your way.
I agree with all what the panelists said. The personal statement, this is your opportunity to tell the program why you should be their number 1 choice, right? This is your advertisement of you as a person and your accomplishments. And I know sometimes for women in general, we tend to be a little less out there with our accomplishments. And this is the time to push forth, because you're selling yourself. These people, if they're looking at applications, what's going to separate you from others? And it's going to be your personal statement. So take the opportunity to practice. If you're unsure or you're more modest and can't push past that, find someone who can help you identify your strengths and then brag about yourself. Sell yourself well and tell them, I am your number 1 pick, and this is why.
I love that. I am your number 1 pick. Everyone on here, and I'm just kidding. But Alyssa made a good point. She wanted to get a specific view on this for people who are interested in triple board. And also another question we got was, is it okay to say child psychiatry? Like, I know I want to do child psychiatry in your personal statement.
I can start with that, and then Sansea can jump in. So with triple board, the personal statement, really needs to be a separate personal statement for triple board programs, that where you're describing why you are interested in the integrated pediatric, general psychiatry, child psychiatry pathway, what you might know about it. I think some kind of a sense of how you came to that decision, either through personal experiences or clinical experiences where, there's some med psych interface that led you to think about triple board. But I think, when we're looking through applications and deciding who to ask to interview, if we read an application and it doesn't say anything about pediatric psychiatry, child psychiatry, and just says something about general psychiatry, that it was only one personal statement, those individuals might be put on a wait list, unfortunately for triple board, you have to say why you want to do triple board.
I just want to echo what Jeff said. So if you want to apply to triple board, and in fact, I'm kind of a softie about it. If it's a really great application and, there's a generic personal statement that's for child psych and, it doesn't say triple board, I'm like, yeah, they just didn't know. They didn't have great mentorship. But the truth of the matter is the committee does get pretty particular about it because they're like, they should have known. So you guys are in the room, now you know, and spread the word, because it does seem unfair, but it is a very specific kind of program, and some people don't really apply to it and don't really realize what they're getting themselves into. As far as applying to a general psychiatry program and saying that you're interested in child psychiatry as well, I come from a program where we have a very collaborative relationship between general psychiatry and child psychiatry. Mike Travis is the program director here in Pittsburgh, and we love it when people are very specific about their interests across the board, whether it's geriatrics or forensics or what have you. And so if someone mentions child psychiatry, then that really helps us recruit, the candidates in a way that's very specific to their interests. And so on your interview day, you're more likely to meet child psychiatrists to woo you into our 5-year track. Maybe I should allow some of the other panelists to talk about where that might not work as well in a program that perhaps doesn't have a child fellowship program or an integrated program in. Which I guess no one on this panel would have that specific occurrence, but maybe you'd have some opinions on that.
I can speak. So we're a relatively new program that split off from an existing one, and we don't have a child fellowship within our own institution, but there's literally one 2 miles down the street. So what I've said to people who have applied to our program that are interested in child, you already got me because I'm a child psychiatrist. So you already got my attention from that. But maybe more importantly, I think the maturity and the understanding about why you selected your potential career so early is often, I think, very helpful. So it's not unlike a lot of our applicants now who say they are strong proponents of DEI, but if I see on your application you've done absolutely nothing, then I'm thinking, that's just something you've just told me, and it's not backed up by data, right? And it's just not there. But if you said, you used to be a psych technician and used to work in a children's inpatient unit, and you're well aware that our program obviously doesn't have a child fellowship, this is still a passion. To me, it's not a big turnoff. I think, the vast majority, well, I shouldn't say the vast, but the majority of people probably will change their mind during training as they get more experiences and are on different rotations. And you might be wooed by the dark side like geriatrics, or the better side like addiction, or the fancy side like forensics. And that's okay. I think, if applicants can give us a reasoned decision why they're so interested in psychiatry, or maybe this field of psychiatry, I think that's probably more important to me than saying I'm a child psychiatrist and there's like nothing that I can see in your application or your letters of rec or your extracurricular activities that would support that. I do realize that it can be a wide variety of experiences in medical school. Many students don't have any experience in meaningful experience, I would say, in psychotherapy or even in child psychiatry. So this might be an exploration area. I think if you match it a good program, hopefully the program director will hook you up with the awesome people here in this organization at national meetings and other places, so that, if we don't have it here, what is that program doing towards your professional development? And I think, every good program, their leaders are probably very well networked, and they're going to do what they can to support each and individual trainees' ambitions and interests.
Okay, thank you all for your thorough responses. And just a quick follow-up to that question. We have one more question before we have to do breakout rooms is, what do program directors think about shout outs to programs and personal statements, especially now that we have signaling?
This was kind of the budget signal before, we had signals, is you can customize your personal statement. Can you customize 20, 30? I mean, that is how much work you want to put into it and everything. And it's also how genuine can you be about a real connection to 30 different programs. But if there is a specific tie, when I see someone has put in the work to say, I'm looking at Vanderbilt because I look at it, if it's just, I want to go to Vanderbilt because it's got great training. Well, there's so many great places that give great training. So I don't take that too seriously. But if they say, no, I looked on the website and I saw that you have a school-based program and, I'm interested in school-based psychiatry, that stands out to me.
I couldn't agree more. I like that term, Edwin, the budget way of signaling. It's so true. But I think it can be a really meaningful sentence or two at the end of a personal statement where, let's say you're in a unique situation with a significant other and they've already matched in a fellowship in your city, for instance. Like, please have no shame in talking about your personal circumstance and why moving to a certain geography would be super meaningful. You're more likely to actually, stay in the area and be passionate about being there than potentially another candidate who doesn't have a personal reason. So I couldn't agree more with Edwin in terms of make sure that it's specific, whether it's a career interest, that it's really a good match with what you've learned with the training experience or other personal reasons.
Just one caveat to that. I have gotten a personal statement that said, that's why I want to go to Harvard, whatever, a different school. So you do have to be really careful when you do that you remember to change, who you have, who it's to.
All right, well, that concludes our Q&A session.